All right, welcome back to the Healthy Careers podcast. Today I have a little bit of a life update, as this will be, sadly, the last episode of the Healthy Careers podcast for now. I am in a season of having a lot on my plate, and I have to focus on what's most important, which is obviously delivering candidates to my clients and helping people find better jobs. And so the podcast has been so much fun. It was a lot more fun when I didn't have a child and have to arrange for additional, childcare. And with the podcast, a lot of times, obviously I'm working around people's schedules. They sometimes cannot record until after work at lunch or early mornings, which obviously for me as a mom is family time. So I've decided, instead of trying to fight it and be miserable and until I can give my all to it, I'm just going to take a pause. We will resume episodes at some point. I don't know when that time will be. I wish I had like a specific date, but I just don't know. So I figured I'd come on and share that information. But I also wanted to talk about something that I think is a little bit of a hot topic and something that should be on your mind if you are in a position to hire and or in a leadership role with a company. And that is how you are leveraging technology to help your recruiting process. The reason I say this is that my background outside of owning my own agency and recruiting is that I have always worked with smaller or startup companies as they kind of establish and root in how they want to acquire, find, and hire people. So a lot of that stems down to your brand, how you represent yourself online. It boils down to what types of people do we want to hire, what types of credentials, both technical skills and soft skills, as I like to call them, when it relates to their values, their character, what value add they bring to the team. And so that is really my sweet spot in what I've done, which I think has allowed me to be a better recruiter because I can hire to more than just a good resume. And I have an intuitive ability to feel out people and understand ultimately what that motive is for a change or what they're looking for in their next role. And so I say all of that because I think that there is a huge industry and a huge opportunity for people that do not want to pay recruiters. I understand it's expensive. It's expensive for good reason, because a lot of times without that person, you wouldn't be able to hire them. And then if you look at the return on your investment, let's say you spend, I don't know, 30, 40 grand to hire a physician who then bills $1 million, $2 million to the practice. Like, yeah, that's worth every penny, right? If you applied that same concept to anything else in life with a return, you would 100% do it. But in recruiting, a lot of times they also understand that not all of the partners are wanting to do that in terms of an investment. And a lot of places just don't have the line item budget, right? They just don't have the overhead. They don't have the spend. And so what do they do when they need to hire, but they can't find somebody and they don't know where to start? And so that is where I'm kind of shifting how I'm going to be doing business here. And I still will be offering your traditional agency recruiter, hey, we need to hire a doctor. Can you help us find a pain guy? Can you help us find an orthopedic surgeon? Yep, I can do that. I'm going to be a lot more picky with who I work with just because my time is limited. And I want to make sure that if I'm doing the work on something, that it actually, the fruits of my labor will be there. So I'm mainly working in retained partnerships, exclusive partnerships where I know someone has skin in the game, that they actually want me to find them somebody. They're not just window shopping and saying, if you find somebody, great. If not, we'll be fine. That's update number one. Update number two is that I'm also offering an alternative recruiting solution, and that is helping you assess where you're at and then where you want to be. So let's say you have one internal recruiter, or maybe you have someone in HR who's not really over recruiting, but they're handling it, but not to the extent that you want them to, or they don't have the formal training when it comes to physician search or PA and MP search, and you want them to get to a point where they're at an agency level and they can understand what you're looking for and screen resumes and screen candidates and go out and hunt rather than farm candidates. The difference is obviously like you're hunting people that maybe they're not applying on Indeed. You're farming people that have sent in their resume. Most HR professionals are just farming. They're not hunting. That's really what differentiates agency recruiters from internal. But that doesn't mean that the internal person isn't capable of hunting and or that you can incentivize them to hunt. It also does not mean that you have to continuously pay 20% of salary fees or large recruiting fees in order to grow and hire folks. And so the solution that I'm bringing is a consultative approach of saying, okay, here's where you're at, here's where you want to be, and here's where I think you need to implement certain things, software, databases, recruiting tools, AI in order to streamline the initial part of that recruiting and that hunting, which is the sourcing, finding the candidates. ZipRecruiters is like finding the needle in the haystack, right? So finding the needle in the haystack, that purple unicorn that you're not getting applications from and that this is the profile that you need. You can leverage AI to do that while you sleep, while you're working on different competing business priorities, and then implement a system that works harder for you and smart. Let me rephrase that. Works smarter rather than harder for you so that you can bring that process fully in-house and maybe only have to use that agency recruiting spend on your very, very difficult roles that you've already put it through that system and that hasn't worked because of location or expectations or experience or niche or whatever it might be. But for 95% of your roles, it should do the trick and it should allow you to keep that money in-house. I think it also is very beneficial for people to get ahead of leveraging and implementing these systems and AI internally because that's what recruiters are using and it is going to replace recruiting eventually. And so if you have a good grip on how to do that, then you're not behind the mark, and everything in recruiting and finding good talent and finding the right clinicians, the right docs, the right support staff is all about timing because it is a candidate driven market, meaning there's more jobs than there are candidates. And so how we get ahead of that is being able to be competitive, not only in what we offer, but how we're finding people and promoting our brand and what we can offer them to come somewhere else and have a better job. So that consulting is going to be more so of like a learn it once, implement it once, use it forever, and save on all of those recruiting costs. And that service will be obviously something that I work with you one-on-one with your group, training people internally, getting systems implemented, recommending different software, databases, tools that I think will lend to a return for you without having to lean on recruiters. And I'm actually hoping, fingers crossed, to speak on this topic at SAOE upcoming in January, or I think it's maybe February in Greenville. Haven't heard back yet if they want me to, but I'm hoping that I can because I think that this is a huge way for especially private practices to get ahead and find ways to combat the declining reimbursement rates in terms of like, I can't help you with that. The insurance stuff, not my scene, but I can help you save money in other areas so that partners aren't feeling the heat and the burn of that overhead as much. So if that's something that you're interested in or you're keen to learn more, don't know where to start, you're struggling with your internal folks, I'd be happy to help and kind of just outlay what I think may work. So yeah, those are my updates. I guess that was 2 or 3 updates in total. But in saying that the podcast is taking a pause, I do want to give a huge shout out to Grace, who's my editor. She has been phenomenal. She's been my right hand. I couldn't have done it without her the last 3 years. I think it's been 3 years. I want to give a huge shout out to the 80 plus people, brave souls that have jumped on here with me in my no filter and sometimes rabbit holes of conversations that we go down. I have learned so much, gained so many new perspectives, and have a new sense of appreciation for those that are in leadership in healthcare, especially post-COVID. It is not easy. And I applaud those that have stayed in it and who, fight relentlessly for their practice, for patients, for doctors, for everything in between. And so big shout out to those folks that have all come on the podcast. You know who you are. And thank you to the listeners who have supported the podcast and showed up and listened to me yab and chit chat with folks. I appreciate that. And also a huge shout out to Corey over at SharePro Health, who has been a sponsor and continuously supported the podcast and helped others in, many of the guests that have been the podcast are listeners. And so my list of everybody that I could think individually goes on and on. This episode will be way too long. So with that, I will end it there and thank everyone again for taking the time to listen. I hope that everyone has a great day. And if I can be of any help to you, please reach out to me. You can find me on LinkedIn. You can obviously message me here, or my email is madison@advancedscopetalent.com. Thanks so much.